This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch, every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly FANTASIA, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We'll talk about the who, what, when, where, why, and how of Innovative Medical Associates, how Dr. Molly and her staff can help you, and how it can potentially improve your overall quality of life. 855-839-1210 is the number here in the studio, 855-839-1210. And as always, a pleasure, Dr. Molly.
It's good to be with you, John. I didn't know if I was going to make it today. I had like a 6-day week, and
well,
Dr.
you have
Molly
that every week, right?
Well, yeah, in one way or another. But actually, on the clinic floor, I actually feel like I'm so happy that I follow my own medicine. That's all I can say.
That's a good thing. You know, I thought we would start off today by this whole journey of you doing this, and it's been like close to 30 years. I think it's like 27 or something.
27 years, yeah.
But it actually wasn't intended to start this way, but it started because of a severe medical challenge that you had. I had a medical
challenge myself. And what happened was, I'm traditionally trained. Look, I'm a scientist. I'm traditionally trained. I'm a clinical chemist, I like to say, by trade. I've improved on that through the years. I'm a clinical chemist, a molecular chemist, I would say. And so what happened was I just knew there was a better way to do things. I mean, I didn't like what the conventional medicine was going to do for me. Yes, you hear that I say to you guys, everybody, look, don't throw away your medications. If they put you on a drug, you take it. Do you want the side effects of that drug? If we can help you reduce that, that's what we want to do. And that's what I wanted to do for myself. That was number one. Number two, if you have a diagnosis that is of a chronic nature like cancer or autoimmune disease, and you need to make sure you stay on top of that for the rest of your life, how are you going to do that in a conventional sense other than take whatever new biologic is out or whatever? And 27 years ago, we didn't have quite as many. But the point is, all this time I have realized, and it dawned on me, the light bulb went off, and it said to me that in a continuum of care, they had been using intravenous infusions for all types of things, to deliver life-saving meds, to correct metabolic problems if you were dehydrated, this kind of thing. And I said, well, you know what? Looking at all the nutraceuticals from the scientific point of view, it took me a little while, okay? I didn't learn all this overnight. And I went out to study with some guys who were pioneers in this field, which I really appreciate. And my first medical director, God bless him, was absolutely one of those pioneers. So I was lucky enough to really train with guys who understood this and were doing this for a long time. So what happened is I looked at this as a true medical modality. And 20-some years later, it's so fascinating to me. Now we have things that had a fad trend that says on-demand IVs. Okay, come on, jump in my mobile van and pick out your IV, and we're going to give it to you.
Like a Chinese restaurant.
Exactly, John. And do you know what? You could be doing yourself more harm. No one should pick out their own IV. They can do really harm. They can change their fluid balance. They can get the wrong nutraceuticals. There's a myriad of issues that can go wrong. So I tried to put together something that made this a mainstay within the concept of primary care, because that's exactly what it is. It's ongoing primary care for patients who've come to me with all kinds of challenges. Sure, do I do an occasional drunk? Of course, okay, of course. But that's not what we really are all about. And just because, quote unquote, IV therapy has grown in popularity, it may not have grown in relevance. A little different.
Now, what do you mean by that?
I mean that what we do is relevant to a patient's health. That's what it's all about. It's relevant to helping them control their condition. It's helping them maintain a quality of life. And so, yeah, okay, when you look at this, you've got to really realize that there are differences between what we do and what's out there and being promoted. It's pretty heavily promoted right now.
Okay, talk about that, because I don't think people fully understand what you're talking about.
Well,
talk about the difference between your facility and...
Well, first of all, we're a licensed primary care facility. So in the end, I managed to pull together exactly what my vision was. And I thank God for that every day. Without him, we wouldn't be here. But here's the thing. We need to look at a patient's blood work. We need to look at their radiology. That's what the free consult's all about. When they come in to see me, I'm really tuned in to what is that drove them to me. They didn't just pick up the phone. In fact, this week I had 4 calls for picking up the phone and saying, listen, I want to run in for a quick IV. No such thing here. No such thing. And this is what led me to think about this. Because, what I see is nutritional infusion therapy as an alternative pathway to care, true medical care that focuses in on functionality, John. I want to improve a patient's quality of life no matter what the condition is, because that was a critical part of my life.
So your medical hydration
That's
is
right.
truly that, medical hydration.
Exactly. And so what I'm saying is short term, it's not about that. It's about pulling together what is necessary for patients' functional medicine needs. Micronutrition, let's correct a metabolic problem. In fact, one of the cases I'm going to talk about today is a true metabolic problem. And it's amazing to me that I have seen how many people have suffered from things like autoimmune and dehydration repeatedly, whether it was an adrenal type syndrome or whatever. And so they run into the spa and they get a drip and they say, oh, yeah, I feel better for 4 hours. Well, no, that isn't what we're all about. What we're all about is we want to help you stop suffering from your chronic condition and therefore enjoy your quality of life.
And you do this through the hydration.
Yes.
But you do it differently.
You bet.
I mean,
listen,
this is, state-of-the-art stuff.
Listen, I have excellence in the ingredients that we choose, okay? I only prepare the IVs a couple of hours before an infusion versus the night before or 2 days before that they line them all up. No, that's not what we're all about. I worry about light sensitivity for some of them. There's so many things. I have to worry about the osmolarity, which means how something is mixed together. We can't just throw every nutraceutical in the bag. As you know, we give multiple bags. I want to tell you, that's unique in and of itself. Okay, because a lot of these places have one large bag and everything's in it. Well, you may or may not be getting the full treatment in terms of and results from that particular nutrients. And I think it's very important that we look at the essential treatment plan. For example, I have a woman right now who's suffering from the mast cell involvement. And unfortunately, I left a message. I couldn't get to her this week because I had a ton of other challenges. But when I reviewed her blood work, and it's very specific blood work because I'm looking at specific analytes, I see something went up, something went down. The seesaw effect, just right, Goldilocks. So people need to look that we look at people, Doc and I and all my medical providers, we look at people on an individual basis, and we actually put their IVs together that way as well.
So it's a customized plan
Absolutely.
For everybody.
There's no quick fix, and it's customized, and it's really about the relevance of the IV to that particular patient.
How many treatments, and I've always asked you this, and how many treatments can a person expect when they get started?
Well, look, we've seen if you come in early enough and your condition isn't seriously affecting you, then we're able to see results in as short as 5 weeks or 5 treatments. If you're coming in with stage 4 cancer, we're obviously going to look at a longer time. And, and we run the gamut all the way between, John. I mean, then I have lifers who actually understand that medical hydration is part of their care plan.
That's
me.
That's
you're
me.
one of them,
That's
sure.
right.
But I have plenty others, as you know.
Yeah.
Because when we get you out of the crisis situation, we want you to stay around, right? And we want you to enjoy life. You're going on vacation.
Right.
Okay, and that's what I'm saying. You don't have to be tethered to me, as I like to say. You guys don't need to go steady with me, but for a short period of time, you might have to.
How many challenges have you gotten me through?
I
lost
too
count.
Numerous to count.
I lost count.
But I want to continue that, John. But you're also a good patient because we know it's not a one-size-fits-all, even with the medical hydration. We have to look at things like your outside life, Are you getting enough exercise? Are you doing the right things with your oral vitamins? And as you know, my nurses are on it. I am so lucky to have the range of folks who work with me. I cannot tell you, right down to some people I consult with who aren't in the clinic, but they're physicians in other areas. And actually, I call them up and I discuss a case. Sometimes I do it with the patient. We do a Zoom. This is the way I like to do Zoom. Right from my clinic, we Zoom into another doc and get the info, and then I'm able to say, okay, let's tweak this a little based on what the specialist said. So the bottom line is I have a whole range of consultants who work with the clinic.
And with that, we're going to take our first break of the morning. The show is Health Watch every Sunday, the live version, 8 till 9, right here on Talk Radio 1210, WPH.D. Dr. Molly Fantasia is here, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. The number here in the studio, 855-839-1210. That's 855-839-1210. We always tell you at this point of the show, call early so we can get your call in and we can take some time to really try to hone in on your problem. 855-839-1210. I'm your host, John DeMasi. Dr. Molly and I return. More of today's Health Watch after these words. We are back here on Health Watch, and as always, operators are standing by right now at Innovative Medical Associates. When we're on the radio, they're right there. 856-489-0505 is the number. 856-489-0505. That's the number for Innovative Medical Associates located in Marlton, New Jersey. And you can check out the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Show is Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, and if you would like to talk to her, some open lines here in the studio, 855-839-1210. We're going to talk about, Dr. Molly, you've had some really difficult cases.
Oh, yes.
But it seems like every time we talk about difficult cases, the next one tops the one before.
Well,
and this one is
John,
pretty difficult.
You know what? Think back many moons ago when I did a young man named Michael.
Yes.
He had a metabolic dysregulation, and that's what I want to talk about
I remember that.
Do you remember that case?
I remember that well.
Yeah. He was in a wheelchair, and he was on a gurney, actually,
yes.
if you remember. And several other young people I've treated like this.
Yes.
Metabolic dysregulation, not to be confused like with total metabolic, let's say, disorders, like things like diabetes and those kinds of things. I'm talking about cellular dysregulation, mitochondria, the powerhouse of the cell, dysregulated. I have a young man who came in from out of town. This family came from out of town. So that's one of the reasons why I was working so hard this week, okay, and into next week, because his case is very, very complex. But after reviewing all the records and sitting with a couple of my docs and discussing this and looking at everything, initially we really thought that he had a tumor possibly on the pituitary, the adrenals, or possibly on his parathyroid. We got back all of his studies, and I have to tell you, I'm talking about a box full of studies. We finally got him from the hospital where he was treating through the emergency room. He was extremely dehydrated, and he gets dehydrated. So what's going on? Well, what I believe it is, it's a metabolic dysregulation that really is biochemical in nature that really impairs his mitochondria in various systems, meaning affecting certain tissues, right? So that being said, we really had to look at this and say, okay, so how do we treat this? Well, this week, after I got all the reports and we reviewed the reports and we realized that this can be corrected with nutritional medicine and some sub doses of traditional pharmaceuticals. So you notice we're using both, okay? We understand that we think this young man is suffering from poor energy production in every single area of his body, whether that's digestion, respiratory, mental clarity. He's a mess, okay? So we took a complete history, we looked at this, and I started him on an IV therapeutic treatment protocol, which, by the way, included your favorite, vitamin C, but many other things that are essential nutrients that will help his mitochondria regenerate. So metabolic conditions affect every aspect, okay, of our metabolism, and it's our metabolism that keeps us going, right? You've heard this before,
yes.
Right? So what are some of the symptoms that he came in with? Well, he couldn't sleep. He couldn't digest his food. He didn't want to eat. He felt depressed. He says he can't connect to people. Well, right there, I'm looking at his whole circadian rhythm. When does he sleep? What's going on? And we find out that he doesn't sleep well. He's up at night. He has pain in the neck. He has pain also. So, okay, we have to bite this apple one bite at a time. So the most important thing right now is to help correct the dehydration, because can you imagine what it's like to be totally dehydrated, John?
Oh, I couldn't imagine.
No, it's pretty bad. It's pretty bad.
It must be,
I
yeah.
mean, there's vomiting, there's chills. You go from hot to cold. I mean, there's a whole problem here. So we started to utilize certain amino acids. Why? I need him to bulk up. I need him to get something. He's not eating properly. So his first week has been doing nothing but amino acids, vitamin C, micronutrients, certain B vitamins, because I don't have all back his genetic testing yet. Okay, I did this on Monday. I won't have it back because unlike the FBI, our laboratories don't do rapid DNA,
Right.
Just so people understand that. So it takes some time. But once I get that back, I can even tweak this a little more. But going on what the doc and I had looked at, we know that this boy needs a certain amount of B vitamins, in particular B1, which is thiamine, which works on many, many areas. And it's not just I'm talking about on a cellular level, John. Not like, you get your B12 shot. Well, how about for him, cyanocobalamin didn't work. Okay, because I'm sure he has the dysregulation in the gene pool that says the cyanocobalamin isn't good for him. I already switched him up to a methylcobalamin as well as a hydrocobalamin and saw the difference in a couple of days.
You know, I'm just listening to all of this, and I'm thinking to myself, how did this person, and he's young, right?
Yes.
I mean, he's like in his 30s.
33.
33. How did he get this bad? I mean, what caused all this?
Well, I'm going to tell you. He could have had a tick bite. He could have had a spider bite. He could have had many things. But something assaulted his body because he was good. This only happened about 4 or 5 months ago. But since that time, he's been struggling. I still don't know what the cause and effect is. It could also have been environmental. He works with concrete. Now, I'm told that how they do this, they're just doing the pores, so he's not really mixing the concrete, so he's not getting the vapors from that. But I don't know, they're coming in from out of town. I don't know what environmental issues could have triggered this, but something did trigger this. It's not just in his head. Oh, it's in his head because he can't think straight. I agree with that, but he's not crazy.
And wasn't his treatment from the hospital, was it like they said, we don't...
Well, there's not much we can do beyond this, and that's it, except put him on what? Antidepressants and mostly antipsychotics. Well, I don't know why a kid like him needs antipsychotics. He has 3 beautiful children. It seems to me that up until 4 to 5 months ago, he was doing well. What I think is his brain is starved of the nutrition it needs to function properly. So, of course, if I look like him, did you see what he looked like when he came in? Yeah, he's awful thin, right?
Yes.
Don't you see he's undernourished?
Yes.
Okay. So I can just see that without doing anything else. And I'm not ruling out that he isn't suffering from some underlying autoimmune disease, because we can't get those back until the middle of this week. So, again, what we have to do is meet a patient where they are, but I also have to do the archaeology of his previous treatment.
This is a very, very complicated case.
Oh, I've done this before with the help of my wonderful docs. So, I mean, one of the things I know I have to do, he has to get something called L-carnitine, right? Because he has to decrease soreness in his muscles and muscle fatigue, So and that's an amino. So we have so many amino acids we've got to give him, both essential and non-essential. So his energy metabolism is the problem in my mind. And I think the doctor agreed with us, and one of my specialists agreed with us. So really short-term therapy isn't going to do this. He's going to be with me, I think, at least another week, possibly another week and a half.
And he's from out of town, so he's not going back.
No. He's actually staying at the hotel. He did tell me he got in the pool with his kids, which was a very positive thing as far as I was concerned. But when I saw him yesterday, I still was worried about the level of his fatigue, etc., which I know we cannot just treat with B vitamins, not going in and get yourself, like you went to your old-time doc and you got a B12 shot and you were fabulous. No, that's not working for him, because I'm sure there's a genetic issue with this as well.
Is there one or two nutraceuticals that you're looking at that can help him the most?
Yes, I think vitamin C is going to be very, very important, and I think the extract of vitamin C for him is going to be important. I'm considering using the cassava C for him on an ongoing basis. I want to see how he does this past weekend. Actually, it's not a weekend, it's just today. I want to find out how he's doing. Magnesium is going to be very important. I know that he needs some mineral combinations, potassium and certain salts. So I think that we're going to have to look at all of this, John. It's not one size in this case is going to be all for him. We really got to look at various nutraceuticals that work on the mitochondria, coenzyme Q10. Very important. I let him leave with some.
Now, he's going to be with you a couple more days.
Well, I think he's going to be with me longer than a couple more days.
Okay.
Yeah.
But when he leaves, goes home.
Yes.
What are you prescribing, or what are you?
Well,
what
we're
going to
give him a list of nutraceuticals that he's going to be taking. All right. He needs to go on enzymes for his food breakdown. We've got to get those. We've got to get it to a micronutrient level. So he's going to be on enzymes. He's going to be on pre and post biotics. Very important. His gut health is extremely important for his mental health. Which sounds crazy, but we know the gut's the little brain, right? You've heard me say that before. So the thing here is that he's going to be talking to me week to week. I also have a relationship with a registered nurse out there who unfortunately can't do the kind of IV therapies I do here, but she's pretty sharp in terms of functional medicine, so she can help me coordinate the orals with this gentleman. But I would tell you that he is worse than any chronic fatigue patient I ever saw. Any person. He has migraines. He's suffering from that. So, of course, the magnesium is going to help that. So we have he has a myriad of problems, and I have to, again, say to you, I've got to do this system by system. But he reminds me so much of that Michael's case, I cannot tell you.
And that was a tough case.
Yeah, and I'm still not sure what other medication they put him on because it's not listed in the chart.
How much improvement have you seen so far?
Well, probably 30%. And that's
which is good.
Significant. It's significant. As you know, as I remember back in time, and just remembering Michael's case, I remember for the first 3 weeks, we got very little improvement. But by the fourth week, it really started to kick in.
I remember you slept at the clinic.
Yes, it's true. It's true. I feel like I'm sleeping at the clinic right now. Yeah. The other thing we have to look at for him is we have to see how his hormone levels are affected, and we will. So, again, John, this is one case. Look, think about this. This is one unique case, and the time it takes for myself, my doc, my nurses, for this patient's overall condition.
We are coming up on the halfway point of the show, and we still have plenty more to talk about here on the program. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Questions for Dr. Molly, or you have a medical challenge? 855-839-1210 is the number here in the studio, 855-839-1210. We are coming back with more of today's edition of Health Watch after these words.
Kale and Company, weekday mornings, 6 till 10.
I'm just saying, when should kids stop trick-or-treating?
You're never too young and you're never too old. It's a day to have fun.
I would say this, too. We don't have to sit here and rank the candy because I'm not a huge candy person, so to speak. I'll take the little 25-cent bags of Party Mix. You're not a Party Mix fan?
Horrendous.
Oh, I loved Party Mix back in the day. I might grab a bag during the next commercial. Eat it on the air. Drive you guys nuts.
Please don't.
Start your day with Kale and Company, weekday mornings 6 till 10 on Talk Radio 1210, WPHT, and the free Odyssey app.
There are so many discounts and offers at Cherry Hill Volvo. This 30-second spot is not enough time to share all the benefits of purchasing or leasing a new Volvo from Cherry Hill Volvo. Discounts and incentives for this month start at $5,000 and can be as high as $11,000. Purchase or lease a new Volvo from Cherry Hill Volvo now and take advantage of these fabulous discounts and offers. Visit us soon for the best selection of Volvos. The entire Cherry Hill Volvo team is waiting to partner with you.
Hey, this is Norman Chaikin, also known as Norman the Floorman. I was running a dating service for chickens, but I was struggling to make hens meet. Calling all developers, investors, house flippers, and savvy shoppers. I'm selling plush carpet at 99 cents per square foot. I haven't sold carpet that cheap since 1969. Visit us online at normancarpet.net or visit our Bryn Mawr or Conshohocken showroom. Call for a free home estimate, and oh yes, 48-hour installation available. That's 800-220-RUGS.
Be sure to follow Talk Radio 1210 WPHT on the free Odyssey app. Download it now.
This program is paid for by Innovative Medical Associates.
We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates. And you say, well, we're listening to the program. Why should we call the operators? If you would like, you can get more information, and the most important thing you can do is schedule the initial consultation with Dr. Molly. It is complimentary, and all you do is schedule it by calling 856-489-0505. That's 856-489-0505. The initial consultation is complimentary, as I said, 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. A lot of good information on that as well. Check it out, innovativemedicalassociates.com. It's Health Watch every Sunday, 8 till 9, the live version here on Talk Radio 1210 WPHT. And if you want to call Dr. Molly right now, 855-839-1210 is the number. We're picking up on more of these metabolic dysregulations,
sure.
Dr. Molly.
And, you know, one of the big ones, John, is something you know about a lot, diabetes. So, you know, we have specific protocols for diabetes in that what we want to do is improve your own insulin sensitivity. So how do we do this? We can do this with the chromium that we deliver IV. We can do this with certain other nutraceuticals, alpha lipoic acid. There are many things we do with a particular IV for diabetes. Again, look at this as what it is. It's a chronic metabolic dysregulation on a cellular level. So our diabetic protocols are such that, for the most part, we never tell anybody, get rid of your diabetes medication. What we try to do is help a patient look at their blood panel and say, okay, what can we do? Can we improve their lipids, right? You know, it's interesting. Most of the diabetics we have, with an exception like with folks like you, are overweight, have lipid dysregulation. So what do we need to do first? We need to chelate. We need to reduce some of the lipid issues. So again, it's a process, John. We don't just throw an IV together and say, oh, this IV is going to help your blood sugar. No, we have to look at some of the underlying things that are also contributing to this condition.
And what are the underlying things?
High lipidemia, how they eat. They're eating, maybe they don't eat meals in a normal routine, you know. Are they eating too much carbs? Amen. You know that the carbs are a big deal. And why aren't we looking at that and possibly looking at putting them on certain things that can help reduce the carbs? Well, we do. And so the other thing, you know what's interesting? Sleep disorders during diabetes. Sleep disorders during diabetes. If you don't get enough sleep, if you're not getting enough sleep, what happens is you have a disruption in your metabolics. So there you go. It's not one thing, John.
Okay, we're going to go to the phones. We'll talk to Jane in South Philadelphia. Jane, you're on Health Watch with Dr. Molly. Good morning.
Hi, Jane.
Good morning, Dr. Molly. I wanted to ask about amino acids. I got 3 little things I want to clear up about them.
Sure.
Okay, so it says that amino acids is the body makes some of them, but the body don't make others.
Yeah, that's right. That's exactly right. That's why they call them essential and non-essential amino acids. Don't be fooled. Yeah, you should take some. Are you an athlete by any chance, Jane? Or are you just looking for overall health? Okay.
No, yeah, I'm just got the question. So when you say non-essential, what's that? That body makes that one, or I don't get it.
They're saying it's just, you know, it's like what I talked about a few weeks ago when I said sometimes what happens is we call something non-essential. I don't know if God thinks they're non-essential, okay? But the point is, here's the thing. There are certain nutraceuticals, and there are certain amino acids that are very good for certain areas of the body, like for the muscle, right? The L-carnitine for the cardiac muscle. Alpha lipoic acid is another amino acid that's good for glucose regulation. There are a number of amino acids, and one of the things I would tell you is watch the kind of powder you get. Are you taking amino acids right now, dear?
No, I just want to understanding of them.
Oh, it's a little bit, I'll tell you, it can get very hairy, okay? The things you need to realize is that the body has a way of utilizing amino acids, and therefore, particularly for energy, and I'm talking about cellular energy, like the cardiac function, those kinds of things are codependent on some amino acids. So you want to look at that. I would tell you the best way to get your amino acids, believe it or not, meat has amino acids. That's why I'm not so pro only for a vegetarian diet, okay? Because some of my patients need to eat some meat. Like this young man I'm talking about, he can use a good meal. He said, you know, I really like steak. I said, well, go have one. So, yeah, you can get some amino acids from your food, and I think that's one of the ways to do it. But I would love to go into a big discussion with you at some point at another time, because you can't do this in a 5-minute deal.
Okay, well, let me ask you about mixing the amino acid. Do you take amino acid with omega fatty acids or malic acids, or you keep them separate?
Yeah, you can do that. As a matter of fact, you definitely can do that, and actually there's a good product out that has done just that. Yes.
Okay, and the last question is, some of the amino acids have the letter L in front of them, and some of them don't. What do that L mean?
L-carnitine. I have to tell you, I'm not sure, except that I know that they're there, and I know that some things are referred to by L-carnitine and some of the other stuff. I'll tell you another thing you do need. Take coenzyme Q10. It'll help you. Okay?
Jane, thanks for the call. We appreciate it.
She actually asked very good questions, but you can't go into an amino acid. What can I say? The amino acids are so complex. If you remember, I had a huge chart on my wall
I remember
talking about how the amino acids were really utilized within the framework of the body.
And it was complicated.
It was
I remember.
very complicated, and in fact, it takes up one whole course if you're studying amino acids. But she's right to look at that. And interestingly enough, she mentioned something about lipids and using fatty acids, those kinds of lipids I'm talking about. And I just got in a wonderful product from Italy that has an olive oil extract that they're using, and they're combining that with an iron. And do you know why, John? Because it's better on the GI tract. The lipid portion of this it goes into the GI tract and allows the patient to absorb the iron better. So it's like a piggyback on each other. I have to tell, at some point we'll do a whole show on this. And I do not carry oral supplements, but I am carrying this particular supplement. It's coming in from Italy. It is unbelievable, and I'm going to help my people who are iron deficient with that, along with delivering the IV iron, because I'm finding that this can hold the iron level over a longer period of time by utilizing the olive oil extract.
And what's it called?
Well, no, I can't go into that
okay.
because you'll be having the FDA all over me, right?
Okay.
So come on in and let's talk.
All right. 855-839-1210.
I tell the truth, John.
Is the number here in the studio.
Yeah.
Well, listen, I just asked the questions.
I know. You can look it up under Pharma Nuturia if you'd like. Okay.
We were discussing
the metabolic issues.
Metabolic issues.
I think that they're so numerous that it is very difficult. For example, some people believe that certain cancers are metabolic in nature because a lot of patients who have the comorbidities with the cancers are metabolic morbidities, like the diabetes. So, what comes first, the cancer or the diabetes, or did they both happen at the same time? Certain other people think that, chronic conditions, which I think cancers are. I mean, I look at cancer as a chronic condition, not just as a metabolic dysregulation, which we know it is, because what happens? The cell goes crazy. The mitochondria of the cell is dysregulated and all kinds of things happen. The other thing that I think is very important in terms of this type of discussion is the outside influences on the metabolics, which I included the mast cell situation or the environmental triggers. Like, what triggers us to go wrong? It can be anything. It can be a toxin of some kind, whether it's delivered by the Lyme disease situation, which, by the way, is out of control in New Jersey right now. I'm seeing more and more patients. I have a patient right now who we got a biopsy on her, a muscle biopsy that says she has inflammation in the muscles. And the question is, well, what kind of inflammation? It's non-specific. It's just saying she has inflammation in the muscles. And I'm looking at that as possibly a Lyme situation where she actually was bitten by a Lyme tick, and the present test results say it's negative for Lyme. But what about the post-Lyme? And there you go. There you have it. And there's a metabolic issue that develops because the post-Lyme syndrome, I believe, is really a metabolic consequence of the tick.
There's so many things that you've been saying that come into play here.
Right.
How do you prevent some things like
this?
Well,
I think you've got to continue making sure that your nutrition is correct. The young lady who called in and said the amino acids, but it's more than that. I think you need to do a good multivite. You need to look at some other things. I think coenzyme Q10 is so important for cellular health at a certain age that I myself take quite a bit of it, not just in the IV. So I take a shot, I do the orals. I mean, I'm on it because I have to keep going. So, the joke is, don't worry, my CoQ10 will keep going even after I'm gone. So actually, I think one of my nurses said that to me. And I think it's true. I think that there are some things that are needed for disruptions in our life, when we're working too hard. And listen, age-related, we need to look at some of this. Truly, when you look at anti-aging, I look at anti-aging metabolics, John. Not just how we look on the outside, but what's going on the inside.
It's complicated.
It's complicated, John,
That's for
and
sure.
it's more and more complicated as we get older. And there are many deficiencies on a micronutrient level. In other words, you can test that you're within normal range, let's say for vitamin D, but for some conditions, we'd like you to be. It's the Goldilocks theory. I don't want you to be too high, but I want you to be on the higher end of normal for certain conditions like fibromyalgia, like chronic fatigue. So there are many things that we have to look at.
We are coming up on our final break of the morning, which means you still have time to get in here with a question or a comment or a medical challenge that you want to run by Dr. Molly. It's 855-839-1210. That's the number. And like I always say, call now, because you call at 2 minutes to 9. We can take the call, but can't really delve into your situation. 855-839-1210 is the number here. It is Health Watch every Sunday, the live version, 8 till 9, right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We are coming back with more Health Watch after these words. We are back here on Health Watch. Operators standing by right now at Innovative Medical Associates. And, well, we always tell you, they're not leaving it when we leave the airwaves. They'll be there well after we leave you at 9 o'clock. 856-489-0505. You can call now. You can call after 9. You can call this afternoon. 856-489-0505 is the number. It's Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, if you missed any of today's show or you just want to hear it again, it's our Health Watch replay this afternoon, 4 until 5, right here on Talk Radio 1210 WPHT. We've got a couple of minutes left of the program. 855-839-1210 is our number here, 855-839-1210. Want to talk about at least one of your cancer patients who's doing very well.
Right.
And
it's an interesting case.
Yeah, it's a very interesting case.
So her husband is one of my nurses. You send out a shout out every week to him. And it's an interesting thing. She's on her second round of the chemo. She had a little bit of a setback on the first round, but she's doing exceedingly well through this. One of the reasons why I think she's doing so well is she comes in twice a week for her nutritional support. And she's holding her own with weight. She's doing fairly well on the sleep. And I would tell you that is interesting, because what I believe is happening, and this is what we were trying to do, is we're trying to use things like vitamin C as a pro-oxidant. A lot of that has to do with how you dose vitamin C, where you extract vitamin C. So in her case, we believe it's enhancing the chemotherapeutics. She's decided that this is the way she wants to go. She follows a very, very interesting diet, because she doesn't, her husband and they don't believe in just plant-based diet. Now, I have another wonderful cancer patient, Pam, who follows a really, really wonderful diet. She doesn't eat much meat, okay? They don't eat much meat, but they eat more than, let's say, lots of other people who have cancer. So here's the thing. I believe your metabolics are unique to your genetics. That's what I believe. And so in this case, I think she's doing the right thing.
And we'll pick that up in just a moment. We have Gary in Long Beach Island. Gary, good morning.
Hey, Gary.
You're on Health Watch with Dr. Molly.
Oh, guess who was asking for Gary? Hey, Gary, was asking for you yesterday, Father Paisley.
Who was asking for me? Oh,
our good father. He's a wonderful guy.
Well,
how you doing, Gary?
I'm doing great. And I just wanted to mention I've been remiss for not calling earlier, just saying thank you for all the years Dr. Molly has taken care of my injuries, kept my immune system up, and the same with my wife, Jan, to keep us in such good shape all these years and all the heartaches I put you through.
No,
I just want to give you a thank you. Thank you very much.
Thank you so much, Gary, and we appreciate that. I really do. And God bless you and Jan. And again, Father Paisley sent his regards. God bless.
Oh, that's great. Well, we'll see you Thursday.
Thank you, honey.
Okay.
God bless.
Thanks
That's
for the call,
great
Gary.
call. They're wonderful
Gary is a
people.
patient, yes.
He is a patient. He's a wonderful guy. They're young at heart, and they look fabulous, and they know how to care for themselves. We've had, look, this is not holy water. People have to keep it up in order to maintain their quality of life. We know this. Not just this, but also, some exercise. Make sure you're not overeating. It's the Goldilocks theory, no matter what.
Yes.
Just right. So that's the call.
Getting back to the cancer patient.
Yeah.
And what you do and the traditional treatment. A lot of people get the traditional treatment and they're devastated.
Well, my job is to keep you well through that. So again, we're not going to do anything that's going to, let's say, negate what you're trying to do conventionally. But, I have a consulting oncologist. So, I roll some things by him on an ongoing basis. And I can tell you that, we chat about people going through chemotherapy. And, of course, I'm not against that, but I want to keep you as well as possible. And there are ways to do chemotherapy that can help. And there's some tricks to the trade, so to speak. And I try to educate all of our patients, and my doctor tries to educate all of my patients. And I believe we do a decent job of it. But, again, it's the individual patient and what they do at home, too, that helps.
So you enhance the traditional treatment,
we're trying to help them through. We're going to enhance their quality of life while going through it. Okay, and therein lies the rub, John. Most people fall apart from the chemo because they're just in such bad shape when they start it. You come in to see us early on, and I think we can help.
And you enhance with all conditions.
Oh, my goodness. That's what we do. I mean, our whole thing is, look, we aren't a spa. We're never going to be a spa. The first segment said that. I don't want to be a spa. You're not going to come into me and say one from column A, one from column B, throw the dessert in. We're just not going to do it. It's not where my heart is not in that. My heart is in keeping people together through any kinds of problems, whether it's pain, cancer, devastation of any kind to the body. That's what we want to do, and we want to see improvement.
I know you wanted to talk about another patient, Pat.
Oh, yeah, Pat's another cancer patient. And by the way, her children are chiropractors, very, very intelligent people. Pat comes up from the Shore area to our clinic. She's doing very well. She just had her PET scan. Things did not grow. She has two that are not there. I mean, I have so many cases like this, it's hard to believe. But God is good to the clinic, and God is good to my patients. So, we see improvement in their cancer status, and that's all we can ask for. For example, we may not see your tumor shrinking, but if you're at stage 4 and it stays the same, God bless.
That's a win, right?
That's a win for me.
Yes.
Yeah.
What else can people do as far as improving their condition? What do they do at home, or what do they do
it's food intake. Again, it's food intake. It's the right vitamins, minerals, and amino acids. It's utilizing brands that work for you, that aren't, don't have fillers. It's utilizing your medications in a proper way, so you're not overtaking meds. It's about really a simple thing like more walking. That's what I do. I mean, I'm certainly no athlete, John. I'm 70 blankety blank, and I walk. I try to walk every day. So, I mean, these are the things. And you need your sleep. You need your sleep because that circadian rhythm is so important in our body's metabolic rates.
It is important for sleep.
Sleep. And I know as we get older, we tend to need a little less. But nonetheless, you got to practice good sleep hygiene, right? Shut the TV off, which sometimes I'm a culprit. I do the same thing. Yes. I just get home and I want to hear something in the background. But the point is, you really got to work at that. And as we get older, we need to work at it a little more. But you told me you slept great this week.
I did. I really did.
I think that's wonderful. And there are many natural products. The other thing is, look, John, nobody is devoid of stress. Nobody. just living today, whether your kids, your grandkids work. How many of us are in our 70s and are still working?
You're looking at two of them
right
here.
Right across the table, many of us. And that's not a bad thing in and of itself. But you also need to know when you need to rest. That's what's happening to Dr. Molly right today.
Okay. And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators standing by right now. They'll be there after 9 o'clock. 856-489-0505. 856-489-0505. Check out the website, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, our Health Watch replay this afternoon from 4 until 5. If you missed any of today's show, you can catch it right there. 4 till 5 this afternoon here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Donna, Vicky, and Daniel, and of course Joanne, fabulous Fran, delightful Dee, and our medical assistant Sandra. I'm your host, John DeMasi. Thank you for listening. We will do it all over again next Sunday, 8 till 9, here on Health Watch on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.